Thank you for giving me this opportunity to talk about the possible connection between COVID-19 and exposure to radiofrequency radiation. I would like to begin with 4 postulates. These are ideas or theories to start a discussion, and they are based on scientific evidence. Postulate 1. Radiofrequency radiation impairs the immune system, resulting in a greater risk of developing an infection that could ultimately lead to more cases and more deaths. Postulate 2. Severe infections, which I call biological trauma, can increase sensitivity to toxins, including radiofrequencies, which in turn could increase risk of electromagnetic interference, or EMI cubed. EMI cubed refers to electromagnetic interference, electromagnetic illness, and electromagnetic injury. If the interference is prolonged, it can result in illness, and if the illness is severe, it can result in injury. Injury can also occur with acute exposure to high levels of radiation. The technical definition of electromagnetic interference is unwanted noise or interference in an electrical path or circuit caused by an outside source. EMI can be caused by natural or man-made sources. For example, lightning could be the source and the victim could be your computer. EMI can cause electronics to operate poorly, malfunction, or stop working completely. It can also cause humans to operate poorly, malfunction, or stop working completely, since humans are electromagnetic beings as measured by brainwave activity and the activity of the heart. Postulate 3. The symptoms of COVID-19 and electromagnetic interference are similar and may be mistaken for each other. Someone who thinks they have EMI may be suffering from COVID, whereas someone who thinks they have long COVID and tests negative may be suffering from EMI. This is assuming that the tests are accurate, and this isn't always the case. Postulate 4. During the lockdown, 5G technology was deployed across the globe, including in Canada and in the United States. 5G technology results in higher radiofrequency exposure that could increase symptoms of EMI, which may be mistaken for long COVID. Epidemiology of a disease involves 3 factors: the agent, the host, and environment. The agent can cause disease or injury, and this can be chemical, physical, or biological. Toxicity and dose are 2 important variables. In this case, the agent is SARS-CoV-2. The host is a human who experiences the health outcome. Risk factors include the health of the immune system, genetics, behavior, etc. The health outcome is COVID-19 and long COVID. The environment is an extrinsic factor that can affect the agent or the host and increase or decrease risk, severity, and duration of the health outcome. The environment can be physical, biological, socioeconomic, etc. Masking, social distancing, closure of schools and businesses, levels of vitamin D3, and/or exposure to sunlight are all extrinsic factors. It is my opinion that confounding factors have not been adequately addressed regarding this pandemic. Here are 2 examples. We know that ultraviolet light from the sun kills the virus, which benefits the host. We also know that radiofrequency or microwave radiation weakens the host and benefits the agent. This is what my presentation will focus on. It is my opinion that radiofrequency radiation in the environment is a confounding factor that has not been addressed at all. During the pandemic, I was following the information provided by Johns Hopkins University and other organizations about the spread of this illness. This map of COVID-19 cases are at the early stage of the pandemic. A question I had was, why do levels of infection differ globally for this respiratory virus? In my attempt to make sense of the COVID pandemic, I investigated confounding environmental factors that could be involved and posted that information on my website. The first factor I looked at was population density, which is important with respect to communicable diseases. However, there were some discrepancies. For example, Africa and India are densely populated, yet the number of cases were low in these locations in April 2020. Here's a graph of population density along the x-axis and COVID-19 cases along the y-axis by continent, and we can see there's a linear relationship with Africa falling slightly below the line. However, North America and Europe fall on a very different trajectory, so there is something different happening here. The COVID case map more closely resembles the map showing Wi-Fi hotspots in 2020, with high levels in North America and Europe and low levels in Africa. In addition to population, these are the potential confounding factors that I considered. Percent elderly, since many of those who became infected and died were over the age of 70. Air pollution and smoking, which is an indicator of a respiratory illness. Tourism and air travel, which indicates global spread. Various economic factors that may differ in different countries. Different types of electromagnetic pollution, which is my area of research. Freedom of the press and internet censorship, as information may be blocked or misrepresented. I concluded that there were some weak correlations, however, the scale was too large and there was a lack of data standardization. So I decided to focus on the United States, and I will discuss this later in my presentation. In March of 2020, a question circulating among electromagnetic experts was, is there a connection between the outbreak of COVID-19 and the deployment of 5G networks around the world? Now you may ask, why would we even ask this question? The SARS-CoV-2 outbreak and the deployment of 5G happened at the same time. Areas with high cases of COVID-19, Wuhan, northern Italy, the Princess Cruise Line, had deployed 5G technology prior to the outbreak. Radiofrequency radiation is known to impair the immune system, which could sensitize people to viral infections. Here's a publication on the reaction of the immune system to low levels radiofrequency and microwave exposures. The author concluded that short-term exposure to weak microwave radiation may temporarily stimulate immune function, while prolonged exposure inhibits the same immune function. This is not the only study showing this relationship. Dr. Henry Lai at the University of Washington reviewed the scientific literature on neurological effects of radiofrequency radiation published between 2007 and 2020. He found 335 cases, of which 244, or 73%, showed effects. This concept is well established among the scientific community. In 2022, Rubik and Brown presented evidence for a connection between the coronavirus and exposure to radiofrequency radiation from wireless communications, including 5G. They state that radiofrequency radiation may cause the following: morphological changes in erythrocytes, red blood cells, and rouleau formation, that I will explain later, that may contribute to hypercoagulation. Radiofrequency can impair microcirculation and reduce erythrocyte and hemoglobin levels, exacerbating hypoxia. Radiofrequencies can amplify immune system dysfunction, including immunosuppression, autoimmunity, and hyperinflammation. It can increase cellular oxidative stress and the production of free radicals, resulting in vascular injury and organ damage. It can increase intracellular calcium, this is calcium within the cell, that is essential for viral entry, replication, and release from cells, in addition to promoting pro-inflammatory pathways. Inflammation has been mentioned twice, and we know that myocarditis, which has been associated with both the virus and various vaccines, is inflammation of the heart muscle. And finally, radiofrequency radiation can worsen heart arrhythmias and cardiac disorders, both of which have been associated with COVID. Relevance for patients. Radiofrequency radiation has become a ubiquitous environmental stressor that we propose may have contributed to adverse health outcomes of patients infected with SARS-CoV-2 and increased the severity of the COVID pandemic. Therefore, we recommend that all people, particularly those suffering from this viral infection, reduce their exposure to radiofrequency radiation. Does radiofrequency radiation and SARS-CoV-2 affect the blood? The answer to that question is yes. COVID-19 started as a respiratory infection and soon became a cardiovascular problem. The emergency doctor in New York who was first to report this lost his job. Radiofrequency radiation can affect the cardiovascular system. as documented in this 2013 publication. Radiation from wireless technology affects the blood, the heart, and the autonomic nervous system. These are live blood cells under a dark field microscope. Slide A is from a person in an electromagnetically clean environment and is an example of healthy blood. Slide B is after a 10-minute exposure of the person to a Wi-Fi router. The cells are sticking together like a stack of coins, and this is called rouleau. The blood in the second slide is thick and viscous, more like ketchup than red wine. When blood is in rouleau, it has a reduced ability to infuse the body with oxygen. It places added pressure on the heart, and in the worst case, it can produce blood clots leading to heart attack and stroke. Here we have another study showing rouleau formation, this time not with Wi-Fi exposure, but rather with radiation generated by a cell phone. The third slide shows oxidative damage to red blood cells that will eventually die and need to be replaced. Does radiofrequency radiation affect the heart? The answer to that is also yes. We did a provocation study where volunteers were exposed to microwave radiation from a base station of a cordless phone. Our study showed that radiofrequency radiation can contribute to arrhythmia, or an irregular heartbeat, and tachycardia, or a rapid heart rate. The definition for tachycardia is a heart rate above 100 beats per minute. Radiofrequency radiation can bring on an acute stress response experienced as a panic attack by altering the regulation of the sympathetic and parasympathetic nervous system. And finally, some people think they are having a heart attack with added pain or pressure in the chest. I'm going to share with you 3 types of reactions to the radiation from a cordless phone. Subjects were connected by wire to a heart monitor and were lying down during testing. They were unaware of when they were exposed to microwave radiation, as was the doctor who assessed the results. This is called a double-blind study and eliminates exposure bias. The blue peaks indicate heart activity. Subject A was tested for 3 periods, each of which lasted between 3 and 4 minutes. The heart rate is shown in red. This person was sham exposed, which means no radiation during interval 1, exposed to microwave radiation during interval 2, and sham exposed during interval 3. There is no difference between real and sham exposure, and this person is non-reactive. Subject B had a different response as shown by heart rate. He was sham exposed during intervals 2 and 4, to microwave radiation during intervals 3 and 5, and his heart rate increased significantly, but only during exposure. This is an example of sudden onset tachycardia. This person is highly reactive, and this is an example of electromagnetic interference. Subject C was sham exposed during intervals 2 and 4 and to microwave radiation during intervals 3 and 5, and their heart rate became erratic only during exposure with a slight increase in heart rate. This person is reactive and showing electromagnetic interference. Their sympathetic nervous system, which can be compared to the gas pedal of a car, upregulated, and their parasympathetic nervous system, that is analogous to brakes, downregulated. The function of the parasympathetic nervous system is rest, digest, and heal. When it is downregulated, a person is unable to perform these functions, and that is why sleep disorders, digestive problems, and inability to heal become more critical issues. This person is having a panic attack, and their response is not physiological, but rather is physiological, but not psychological. I mentioned earlier that EMF scientists were questioning whether there could be a connection between COVID-19 and exposure to 5G. We examined that question for the United States, which keeps some of the best statistics of all countries, including Canada. 5G small cell antennas are placed on street lamps, hydro poles, and special poles designed for their use. Scientists who are actively involved in research on the biological effects of electromagnetic fields are deeply concerned by the 5G rollout. They are asking for a moratorium on 5G. With 5G, there are more antennas since antennas are placed every 100 to 300 meters in urban areas. The antennas are going to be closer to buildings and people, and this is going to increase exposure to radio frequency radiation. 5G uses a broad range of frequencies, and the high band frequencies consist of millimeter waves that have not been used before for telecommunication. Despite this, there have been no studies on human or environmental health. Let me repeat this. There have been no studies on human or environmental health. Despite this, that earlier generations, 3G and 4G, have documented causing biological effects on people, plants, insects, birds, mammals, etc. We are conducting a global experiment similar to what has happened with the various vaccines that were not properly tested prior to their release. We are simply told these are safe and effective. Trust us. We are being told the same thing with 5G. It's safe. Trust us. If we compare the total number of COVID-19 cases and the deployment of 5G for the United States, we see a number of similarities. However, there's a confounder, and that is population density. In densely populated areas, there are more people to develop COVID, and this is where more antennas are going to be placed to serve a larger population. I first examined the U.S. data in April 2020 and posted that information on my website. Angela Siang and I reassessed the data a month later to see if it had changed, and this is what we published. Here are 18 states that did not have 5G millimeter waves. The average for this group is 3,220 COVID cases per million. States with 5G millimeter waves had over 5,000 cases per million. What these graphs show is that there are 2,556 excess cases per million in states where the population was exposed to 5G millimeter waves. This is an 80% increase and is statistically significant. We have results for deaths per million as well. There is an excess of 149 deaths per million in states with 5G millimeter wave technology, and this is a 94% increase, which is almost a doubling of the death rate, and these results are also statistically significant. I mentioned earlier that COVID-19 and long COVID are similar to symptoms of electromagnetic interference, and consequently it's difficult to differentiate between the two. Here are 18 symptoms that overlap: fatigue, muscle aches, cardiovascular abnormalities, difficulty concentrating, headaches, difficulty sleeping, anxiety, memory problems, etc. A person experiencing some combination of these symptoms would not necessarily know what was causing them. And with COVID in the news, most would suspect the virus. This study, published in 2003, well before either COVID or 5G, indicates prevalence of symptoms for people living at various distances from a cell phone base station. The red bars are for people who live within 10 meters of a base station, and the black bars are those who live more than 300 meters away. These are the symptoms in decreasing order, and here we have the percentage of people who said they experience symptoms very often. These symptoms presented here are similar to those on the previous slide. There is a large difference in fatigue, sleep disturbances, and many of the other symptoms. If this was happening today, those symptoms would probably be attributed to COVID rather than exposure to microwave radiation. What happens to radio frequency radiation levels with the introduction of 5G? Verizon has a map on their website that shows the rollout of 5G and the activation of millimeter waves. They call this 5G ultra wideband. You can zoom in on this map, and that is what we did here for New York. This shows the streets in Manhattan, New York, with 5G ultraband in brown. 6th Avenue and 5th Avenue run parallel, and 5th Avenue has antennas with the millimeter waves activated. We have a global EMF monitoring network that consists of more than 400 volunteers who we call citizen scientists. They are monitoring levels of radio frequency in the environment because the government isn't doing this. We asked one of our members to measure 5th and 6th Avenue as shown in this map, and this is what she recorded. Here we have average, median, and maximum levels of radiofrequency exposure measured at 4 corners at 5 intersections for a total of 20 measurements. The radiofrequency levels are much higher for the street with 5G antennas, ultra-wideband. We did the same for Brooklyn, New York, and found similar results. I include the Russian guideline and the Canadian guideline for comparison. Median levels of radiofrequency radiation exceeded the Russian guideline at both of these locations. As a reminder, a median value indicates the level at which 50% of the samples are below this value and 50% are above this value up to the maximum. Here's an example of how 5G radiation affects people. This is an apartment building in Sweden where 3G and 4G antennas were replaced by 5G antennas immediately above 2 bedrooms. The radiofrequency exposure in the bedrooms before and after 5G antennas were installed are shown here. Levels with 5G are orders of magnitude higher than with the previous 3G, 4G antennas. The couple moved to a different location where the levels were much lower and eventually moved to a house in the country to get away from the radiation. The value of 2.5 million is above the limit for the meter used to measure this radiation, and Health Canada's guideline is about double this value. This is the same information as in the previous slide for place and date and for exposure. Here we have the number of symptoms in light blue experienced by the husband and wife, and the total symptom severity in dark blue. The list of EMI symptoms overlaps with COVID. The husband experienced more symptoms and had a more severe response while he was exposed to 5G. The wife experienced even more symptoms and simply could not remain in their apartment under the 5G antennas. When they moved away from their apartment, their symptoms went away. How do we know that they were responding to the radiation rather than to the viral infection? To answer this question, I contacted the authors of the paper, and this is what they told me. Symptoms started within 2 days of the 5G antennas being activated and disappeared within 2 days of moving out of the apartment. By the way, Health Canada would say that these levels are well below guidelines and hence are safe. Anyone could be exposed to them 24/7 with no adverse health effects. Finding safe housing is becoming increasingly difficult for those not wanting to be exposed to this radiation. Our exposure to radiofrequency radiation has increased considerably since the 1990s. This is a graph of cell phone subscriptions per 100 people. In Canada, we had less than 10% of the population using cell phones in 1995. Within 20 years, by 2015, that increased to 82%. Other countries had similar trends. With cell phones, we need cell phone antennas, which began to proliferate as well, increasing everyone's exposure, including those who did not own or use a cell phone. I previously showed this map of Wi-Fi hotspots. 15 years earlier, in 2005, we had very few Wi-Fi hotspots as they were restricted to universities, research institutes, and the military in some countries. We now have Wi-Fi everywhere, in our homes and schools, at work, in hospitals, on airplanes, and even in parks. When we combine this with cell phones and cell phone antennas, satellites and small cells, which are part of 5G, and include smart meters, smart appliances, and smart homes, it's clear that levels of radiofrequency radiation have increased exponentially, and these changes cannot continue to be ignored. Radiofrequency guidelines vary by 8 orders of magnitude in different countries, which is unheard of in toxicology. A guideline is a maximum permissible limit of exposure. I highlight in orange the guideline for Canada and the City of Toronto, which differ considerably. The lowest guideline for the sleeping area in Germany is 100 times higher than levels required for cell phone operation. So why do these countries permit such high levels of exposure as they aren't necessary for the operation of this technology? These guidelines are based on a short-term heating effect. No other biological effect is considered. If it doesn't heat your body, it is considered safe. These guidelines are based on a 6 to 30-minute average reading and were established by engineers and physicists in the 1990s prior to the deployment of cell phones, Wi-Fi routers, smart meters, etc. These guidelines are outdated, yet several government agencies, and that includes Health Canada and the Federal Communication Commission in the United States, are unwilling to revise them. Some countries have short-term guidelines, mostly for occupational exposure. We also have long-term guidelines that are based on the precautionary principle. These are more protective and were developed more recently. They are based on thousands of scientific studies documenting electromagnetic interference and electromagnetic illness, including cancers and infertility, that can be attributed to low levels of exposure. A 2020 publication reported the lethality of COVID-19 is higher in countries that have a higher maximum permissible limit for radio frequency radiation. What does the future hold for 5G technology? This map estimates 5G adoption as part of mobile connections or smartphones and does not include the Internet of Things, so it is an underestimate of 5G usage. As of 2021, North America had 13% adoption of 5G, and this is estimated to increase to 63% by 2025 in just 2 years. Similar trends are shown for other locations. The commercial perspective regarding 5G focuses on 5G being a financial growth driver with plenty of room to grow. The focus is on economic growth with no mention of environmental or human health. Big tech is relying on their friends in government to maintain their current guidelines and thus enable even higher levels of exposure. What does the future hold for vaccines? Pfizer estimates that their vaccine doses in the United States will increase from 65 million in 2023 to 98 million by 2026, the key focus being on economic benefit to the company and their shareholders. With all of this radiation, some people are getting sick. The sickness is known as electrohypersensitivity, although I prefer to call it electromagnetic illness or interference, depending on the severity. Between 1 and 3% of the population are severely affected in developed countries. Another 35% have mild to moderate symptoms. If we could apply these percentages to Toronto, Ontario, and Canada, we can see that in Canada, as many as 1 million people may be severely infected. These people are considered disabled, and those moderately affected have a reduced quality of life. When we have the next viral outbreak, these individuals are going to be the most vulnerable, and these individuals will have a reduced tolerance for other types of life stressors. I've done the same calculations for provinces and territories, and in Saskatchewan, there may be as many as 30,000 people severely affected and another 400,000 moderately affected by radio frequencies. With the rollout of 5G, these percentages are likely to increase. Who is helping these people? Government? No. They don't even acknowledge this illness. Big tech? No. They are contributing to this illness. Volunteers? Yes. But this can't go on as these volunteers are experiencing burnout. We need resources for research on how to diagnose and treat those who have become ill and prevent others from becoming ill. Education and medical training, since this isn't taught in medical schools. Green zones with safe housing. Some people with this sensitivity sleep in their cars in the woods, and this can be life-threatening, especially during winter. We need to accommodate them in hospitals and schools and in their working environments by demonstrating how to reduce exposure in these environments. We need to monitor exposure just like with air quality or the ultraviolet index in summer or contamination of fish populations. And we need to set up a 24-hour hotline for those who are desperate, who are considering medical assistance in dying. This can't be left entirely to volunteers. The COVID pandemic has driven a number of people to the edge, and those who are electrosensitive continue to live on the edge, even without COVID. In 2015, the Canadian Parliamentary Standing Committee on Health, known as HESA, presented 12 recommendations to the government on radio frequency electromagnetic radiation and the health of Canadians. This is the second standing committee to report on the health effects of radio frequencies. The first was in 2010, where they made 5 recommendations. I was one among several experts who presented testimony to both of these committees. To my knowledge, the Canadian government has not acted on any of these recommendations. I will not read out the recommendations, but wanted them included in the records for this inquiry. I would like to end my presentation with some recommendations. We need to place a moratorium on the deployment of 5G globally. This can be done by replacing wireless with wired connections and restricting wireless to mobile devices only. Deploying 5G without prior testing for health effects is likely to have the same outcome as the vaccines, resulting in excess deaths. In the meantime, everyone needs to reduce their exposure to radio frequency and microwave radiation, especially those with long COVID. This can be done by turning off your Wi-Fi and cell phone when not in use, and especially at night when your body is healing. By keeping your distance from wireless technology, not holding your cell phone to your head or storing your cell phone in a pocket or bra. By replacing wireless technology with wired connections in your home and especially in schools. A society that doesn't protect its children doesn't have a future. The government needs to follow the science presented by independent scientists and doctors for both COVID and radio frequencies, and not by big pharma or big tech via their purported experts. They also need to implement the recommendation of the 2015 Parliamentary Standing Committee on Health. The media needs to remain independent of government and their economic backers. The job of media is to gather information and present unbiased reporting, and not to ridicule or silence those who present alternative views. Not everyone who holds alternative views is a conspiracy theorist. Medical regulators have unchecked power, and this is dangerous and is currently being abused. They are slow to learn from scientific studies. This needs to change. They have become a captured agency. Some of the violations regarding COVID include investigating doctors for having alternative views to medical regulators, taking away their license for prescribing approved drugs and saving lives, firing healthcare workers for wanting autonomy over their body. Doctors who diagnose patients with electromagnetic sensitivity are at risk of losing their medical license because medical authorities choose not to recognize this illness, despite thousands of scientific publications and millions of people being adversely affected. Research thrives and advances when scientists are free to discuss and debate diverse views. This is not a weakness, but rather a strength of the scientific method. Society loses when scientists remain silent. And finally, a special foundation needs to be established to fund research, education, and training programs to provide support for those adversely affected by radio frequencies and to protect those who are most vulnerable, especially the next generation. This can be funded by imposing a $1 surcharge for each cell phone subscription, resulting in a sustainable annual budget of $34 million in Canada. The same can be done for vaccine injections. Our lives begin to end the day we become silent about things that matter. This is one of my favorite quotes, and it has guided my life and my academic career. It is important that we speak truth to power. Those who hold power for the right reasons welcome truth. Those who hold illegitimate power fear truth. What we have experienced can disempower us and make us fearful, or can make us collectively and individually much wiser and stronger. It all depends on what we do next. May wisdom and compassion prevail. We need to stop this insanity. If not us, who? If not now, when? Thank you.